The Indonesian construction industry has been growing rapidly in recent years due to the government's focus on infrastructure development. It is a significant industry which contributes about 10% to the country's gross domestic product or GDP. Despite its significance, the industry is a dangerous industry. It is estimated that 30% of all occupational accidents happen in the construction industry. So how can we improve health and safety in the Indonesian construction industry? My name is Risa Yosia Sunindyo. Today we'll discuss about a safety climate framework for improving health and safety in the Indonesian construction industry. Research on health and safety in the Indonesian construction industry is growing. Past research, however, has failed to distinguish between the concepts of safety culture and safety climate. They tend to mix those two terms together. And also there are many research on safety climate, but there is a lack of integrated framework to guide future research and management action. So therefore, to fill in this gap, the aim of the research is to develop a safety climate framework for improving health and safety in the Indonesian construction industry. There are three research questions, as you can see here. The first one, what is the state of safety climate in the Indonesian construction industry? The second one, what are the strengths and weaknesses of this climate? And the third one, what can be done to improve it? So first, we need to define what safety climate is. Safety climate is the psychological dimension of safety culture. I think in my previous video, I explained the differences between safety culture and safety climate in detail. So here, just quickly, safety culture has three dimensions: psychological, behavioral, and situational. Safety climate is the psychological dimension of safety culture. It is about people's attitudes and perceptions towards safety in the workplace. Safety climate can be defined as shared perceptions of employees about the importance of safety within their organization. So here you can see there are 6 dimensions of safety climate: management commitment, safety communication, safety rules and procedures, supportive environment, personal accountability, and safety training. In this research, we collected data from 311 construction personnel in Indonesia using a survey. We also received more than 100 qualitative feedback from those participants. Now let's see the dimensions one by one. The first one, management commitment. So this dimension has 9 items, and you can see the overall score of those 9 items, 4.82. The Likert scale being used in the survey is ranging from 1 to 6. 1 is strongly disagree and 6 is strongly agree. So 4.82 is actually quite good. Those 2 items are the highest score item and also the lowest score item. The highest one, as you can see there, my project manager considers the safety of employees a top priority, 5.07. While the lowest one, my project manager expresses concern if safety procedures are not adhered to. So therefore, we can see the strongest and the weakest item within the dimension. And then we seek qualitative feedback from the participants as well. And they gave some suggestions to improve management commitment. Essentially, there are 3 suggestions. The first one, prioritization. So that is an example of comments given by the participants. Production and progress are not reasons to neglect health and safety implementation. So it means safety should be prioritized in the workplace. The second one, adequate budget. Again, another example of comment. Health and safety budget needs more attention. Generally, in practice, this budget is non-existent or the amount is just simply too small. And then the third suggestion, top management, they need to demonstrate commitment explicitly through their action. Again, another example of comment there. Management should practically implement health and safety and not only theorizing. The second dimension is safety communication. It has 9 items and the average score is 4.74. We can see the strongest and weakest item as well. The strongest one, safety communication, makes me pay attention to safety, 5.11, the average score. So here we can see, really can see the importance of safety communication to build awareness on site. The weakest item, methods used to communicate safety information, are adequate. So the participants felt that the methods are not enough to communicate about safety in the workplace. And then if we see further the qualitative feedback, I gave a couple of examples here. The first one, socialization of health and safety programs should be continued, and unit leaders should be appointed to lead health and safety implementation. So there is an interesting suggestion concerning unit leaders, which is a way, a method to communicate safety information to the workers. And then the second comment there, those on site should be kept updated regarding the availability of health and safety equipment and tools. So there needs to be more regular communication between the top personnel or the top managers and the senior managers with those on site concerning health and safety. The next dimension is safety training. It has 5 items. You can see the score 4.64. The best item, the safety training provided, is practical, 4.89, while the lowest one, I am capable of identifying potentially hazardous situations. If we see the qualitative feedback, the participants also recognize the importance of health and safety training. For example, the first comment there, health and safety training is absolutely needed to provide health and safety knowledge to all. The second one, health and safety briefings should be given more frequently, particularly for those who work in the office and rarely go on site. During the briefings, there should also be practical examples, not only presenting contents. So this is a good suggestion showing the need to demonstrate the practicality of health and safety training. So from the comments, we also can make a conclusion that there is a need to find the effectiveness of safety training in terms of developing knowledge and awareness, in changing attitudes of workers, in changing their behavior, and also in developing a positive safety culture in the organization. The next one, personal accountability. It has 14 items and you can see the score 4.34. The best item, a safe place to work, is very meaningful for me, while the lowest one, it is unlikely that I will have an accident in my workplace. So just some qualitative feedback. I am responsible to work safely according to procedures. And then the second one, health and safety starts from oneself. So here we can see the participants actually see or value the importance of health and safety in the workplace. However, despite recognizing the importance of health and safety, they felt worried about being injured. And if we see the other items within this dimension, we also can see that they felt that they could not influence safety at work. They simply followed instructions from their supervisors or managers without considering safety policy and procedures in their workplace. Also, they were not willing to report their co-workers who work unsafely. So I guess this result is interesting because we need to understand the culture in that particular place, because the national culture, the culture of that country, for example, can affect the way people operate in the workplace, and we need to consider how safety policy and procedures can be tailored so therefore they can match the culture where the workers or the people operate within. Rules and procedures. There are 6 items here, and you can see the score is getting lower, 4.22. The best score, safety procedures, are carefully followed by all, 5.01, while the lowest one, safety procedures, are practical, only 3.67. So therefore, actually the participants felt that safety procedures are not practical. So some qualitative feedback. Facilities and equipment to support health and safety are already quite good. Its enforcement needs to be improved. The second comment, health and safety must be implemented firmly. And the last one, there should be heavy sanctions as stipulated in OHS legislation. So this shows the importance of health and safety enforcement in the workplace. So the results actually support other research which shows that the enforcement of health and safety regulations by governments and also by companies in developing countries like Indonesia are often lacking. While thinking about the practicality of safety procedures, I think we need to consider the concept of revisability or the capacity for policy adjustment in the face of implementation challenges. So this can be problematic when safety policies originate in the head office without consideration of their practical implementation on site. So there is a need to get a feedback as well from people working on site to ensure that safety procedures, safety policies are practical and can support people on site to work in a safe way, but also in a practical way within their context. The last dimension is supportive environment. It has 15 items and the average score is 4.20, which is the lowest dimension among the 6 dimensions of safety climate. The best item there, my co-workers often give tips to each other on how to work safely. So that's good because the co-workers are supporting one another concerning how to work in a safe way. The worst item, my work environment reduces the possibility of accidents, only 3.29. So actually the participants felt that the work environment is actually dangerous. If we see the qualitative feedback, actually we received a lot of comments on this particular dimension, which reflects that this dimension needs a lot of improvement. Some comments there, PPE should be made available, including gloves, dust masks and socks, repeatedly mentioned actually by the participants concerning the lack of PPE on site, which is quite sad and which shows as well probably the lack of commitment from the management if they can't provide PPE on site. Sometimes I still feel scared even though I wear PPE. This comment can reflect the work conditions. So probably the managers only depend on the workers to wear PPE, but then they don't create a safe work environment for the workers. Again, I think we need to consider the hierarchy of risk control to reduce health and safety risk on site, rather than simply asking the workers to wear PPE. Actually, we need to start from the highest way of controlling risk by eliminating them in the first place. The next comment also reflects what I just explained. Please improve the conditions so work can be done comfortably, safely and quickly. The next one, this is more related to housekeeping. Electrical related safety needs improvements in my workplace because there are many puddles. Lighting for night works is needed. Again, the same thing. Safe work environment is still lacking. And the last one is actually quite interesting. Worker accommodation is inadequate for living. So this is typical, especially in developing countries like Indonesia. Usually the workers actually live on site during the construction period, and the worker accommodation is provided by the contractor. The accommodation issues raised by the respondents and other problems as well, actually, in the qualitative feedback, such as access to clean water and even withholding wages, have also been identified as problems in other studies in developing countries. Construction companies in Indonesia tend to use informal workers to reduce costs, and they are often denied basic employee rights. And then lack of attention to construction workers' well-being is also an under-researched issue that requires more attention in Indonesia. So just to conclude, here we can see a safety climate framework for improving health and safety in the Indonesian construction industry. So we have three levels here: at the project level, organization level, and also at the industry and country level. At the project level, there is a need for more visible commitment from top managers. They must demonstrate their commitment towards health and safety more explicitly. Second one, diverse communication channels to ensure that health and safety communication can reach everyone at the project level. More regular update concerning health and safety. Enforcement is extremely important. Again, first at the project level, health and safety must be enforced, and their implementation must be firm as well. Practical health and safety training, like what I discussed earlier, there must be adequate resources as well to support health and safety implementation. Again, as I said earlier, it seems like PPE is still lacking in many projects on site. Health and safety planning. I think I mentioned about the hierarchy of risk control. Again, it should be planned in advance. All the risks should be identified. The risk management process must be followed, and hierarchy risk control should be used to reduce and mitigate health and safety risks on site. No blame culture. There is a big gap between the managers and the workers in Indonesia in terms of their power, because that is the culture in the country. And in some cases, it's quite common for the managers to blame the workers when something or when accidents happen on site. So this kind of no blame culture should be managed carefully. So people, everyone, especially the workers on site, can be embraced to implement health and safety in a more appropriate way. And the last two is about worker accommodation and well-being and welfare. I think these two have not been much considered before when we discuss about health and safety in the workplace. So these two areas should be researched more. And this also can be an additional dimension of safety climate, which should be included in future research, especially in the context of developing countries. Now, at the organization level, some of the suggestions for improvement there. The first one, companies, they need to integrate occupational health and safety budget into their overall project budget, so appropriate resources can be provided. The second one, demonstrate that health and safety is as important as other objectives, so should be prioritized. The third one, health and safety policy, procedures and guidelines should be established, should be developed throughout the company, so at the organizational level and also at the project level. Health and safety management system should be applied and collaborate with others on health and safety. So for example, with other contractors or with their subcontractors, especially with those who focus on health and safety. And the last one, health and safety criteria should be included in the tendering process as well. So rather than simply choosing the lowest bid, health and safety, or value for money, should be used when assessing tender submissions. And the last one, at the industry and country level, there is a need to update health and safety legislation. At the same time, there is a need to upskill human resources. The use of informal workers, for example, if possible, should be reduced slowly, and certificates to demonstrate the skill of the human resources should be introduced, and slowly the skill, the capability, and the knowledge of people working in the construction industry also can be improved, and at the same time their well-being can be improved as well. Enforcement, again, not only at the project level but also at the national level, at the industry level, enforcement of health and safety is critical. So therefore companies in a sense can be motivated to focus more on health and safety. Health and safety criteria in tendering of public projects. So the same thing again, especially the governments, they need to lead the way. Rather than choosing the lowest bid, they can integrate health and safety criteria when assessing tender submissions in public projects. Collaboration to improve health and safety between the government, large contractors, the client, and also professional bodies. They should collaborate together and improve health and safety in the Indonesian construction industry. And the last one, data on informal workers to improve well-being. So the government again should focus a bit more on their informal workers, collect data concerning their well-being, their welfare, where they work, and so on. So therefore, a more accurate interventions can be developed so they can also improve their well-being. So this research was done in collaboration with colleagues in the University of Indonesia. And this research has been published as well in the International Journal of Environmental Research and Public Health. And the title of the paper is a Safety Climate Framework for Improving Health and Safety in the Indonesian Construction Industry. Thank you.